The situation regarding U.S. visas for Gazans, particularly for medical treatment, is in a state of crisis and contention. The U.S. State Department has announced a temporary halt on all visitor visas for individuals from Gaza, including those for humanitarian and medical purposes. This decision was made in response to an online campaign by a far-right influencer who mischaracterized the program as a refugee resettlement effort and a national security threat. This halt directly affects U.S.-based charities and organizations that have been working to evacuate critically injured children from Gaza for life-saving medical care. These organizations, like Heal Palestine, have clarified that the visas are temporary and the children are returned after their treatment is complete. The pause in visas is a significant setback for these humanitarian efforts, leaving some of the most vulnerable people in a perilous state with no access to the specialized care they desperately need, as Gaza's healthcare system remains largely non-functional. The recent halt in visas for Gazans is primarily a result of a far-right social media campaign that misrepresented a humanitarian program as a national security threat. A prominent influencer falsely claimed that the program, which brings injured Gazan children to the U.S. for medical treatment, was a refugee resettlement effort for unvetted Palestinians. This misinformation quickly gained traction among certain members of Congress and conservative circles who began to question the visa process. In response to this political pressure, the State Department announced a full and thorough review of the procedures used to issue the medical humanitarian visas, leading to the temporary suspension. The action was taken despite assurances from charities like Heal Palestine that the visas are temporary and the program is funded by donations, not taxpayer money. The core reason for the halt is a direct reaction to a politically charged social media firestorm fueled by false claims. The decision to halt visas for Gazans, particularly children seeking medical care, has severe and immediate consequences. For many critically injured children, this policy is a potential death sentence. Gaza's healthcare system is in ruins, meaning the specialized surgeries and long-term care these children need are simply not available. A pause in visas, even if temporary, can mean the difference between life and death for a child with severe burns, lost limbs, or life-threatening illnesses. Beyond the immediate humanitarian toll, this action sends a message that the U.S. is prioritizing political pressure over human compassion. It undermines the work of dedicated charities and medical professionals who have been on the ground saving lives. This move is seen as a betrayal of core American values and a significant blow to the country's credibility as a global leader in humanitarian aid. The long-term consequence is a further erosion of trust from the international community and a deepening of the humanitarian crisis in Gaza. Several solutions are being proposed to address the halt in U.S. visas for Gazans, particularly for medical treatment. The most immediate solution is for the U.S. State Department to reverse its decision and resume issuing the temporary humanitarian visas. Organizations like Heal Palestine and the Palestine Children's Relief Fund are actively pressuring the government, providing clear evidence that the program is for medical care, not refugee resettlement. Another key solution is for humanitarian organizations to continue their advocacy and public education campaigns to counter misinformation. By providing transparent and accurate information about the program, they can combat the false narratives that led to the visa halt in the first place. Finally, international pressure and intergovernmental cooperation could provide a path forward. Countries that have strong diplomatic ties to the U.S. could lobby for the resumption of the program, emphasizing the urgent need for medical care and the ethical responsibility to help vulnerable populations in conflict zones.